Hi, I'm Cliff Hughes. I'm a cardiac surgeon and have been for many years. I'm currently working as the CEO of the Clinical Excellence Commission. Today I want to talk to you about open disclosure. I guess one of the first questions is, what is open disclosure? Really simply, it's a frank discussion with a patient and their support person about a patient-related incident. Open disclosure provides an ethical framework for staff and health services to fulfil our duty of care to patients and their support persons. We're actually having a look at this at two different levels. We have a high-level program that we've been rolling out across the state, taking a number of senior clinicians in each of the area health services and major institutions to teach them some of the principles and also to provide a resource to you, wherever you might be, when there is an incident that you feel needs to be discussed with a patient. And I hope that's every time there's an incident. Let me give you a little example. A few weeks ago, I had to have some blood tests done. So I went to the laboratory and put my arm out, and the technician, who I'd seen a few times, put the needle in and missed. His reaction was quite amazing. He took the needle out and gave me a swab to hold over the site and left the room and didn't come back. A few minutes later, another nurse came in and said, "Oh, look, I'm going to take the blood." The technician is so upset he doesn't want to have another go. That's not open disclosure. That's acting out of fear. Had he said to me, "Look, I'm sorry, Cliff, but I've missed the vein," I would have said, "That's okay. I've missed the vein lots of times. Just have another go." So you see, there were two victims in that circumstance. There was myself as the patient, and there was the staff member himself, who was a secondary victim and was feeling bad about what had happened. I'm glad he was feeling bad, but he didn't have to feel that bad. You see, open disclosure says to our patients, we're on your side. We want you to know that we're here to look after you, and today we haven't been as successful as we might like to be, but we're going to try and make things work out better for you. There are a number of principles about open disclosure, and we can just list them, and perhaps you might like to think about each of them. Timeliness. We need to say sorry as soon as things happen. We need to be empathic or compassionate. Very easy sometimes for us to be patronising or formal in an apology. This is a normal human reaction, so let's be empathic. Let's understand how they feel. Let them understand how we feel, that we do feel a bit bad about it as well. Of course, we need to take responsibility for our actions and for our system. We're not going to blame other people. We're going to investigate and try and fix. Above all, we must be honest. We must explain to people what we know, but also let them know what we don't know. In one sense, there's no more honest answer than saying, "Look, I'm sorry, I don't know, but I am going to find out." We also need to be transparent. Let people see just what we are doing about the incident. We're acknowledging it, we're investigating it, and we're going to fix it, and we're going to tell them how all those things have occurred. And finally, we are going to act upon what we've learned. We're going to make sure, if we possibly can, that this incident won't occur again. They're the principles of open disclosure. They're pretty simple. When we translate them to what happens on the wards, let's think of other examples. Suppose a patient doesn't get their medication on time. We can hide that. We can cover it up. We can simply not give the medication. That doesn't fit with any of those principles I just espoused. Or we can say, "Look, I'm sorry, Mrs. Jones, but we missed your tablets an hour ago. I'm sorry, I didn't realise that you'd gone off to have a test and you weren't here when I did the drug round, but it's okay to take the tablet now. I checked with the staff and here it is. And tomorrow we're going to make sure that you do get your medications on time." Open disclosure is as simple as that. So I hope that you'll take the principles of open disclosure and put them into your daily practice. Many of you already have done that, I know. But as part of the health policy, we can be proud that New South Wales is putting this across the whole state as part of the way in which we simply do good clinical care. Thanks.